My name is Marjorie Meyer. Substance use has been an issue with pregnancy for a long time, and that's why it's so important for people to continue to think about it and discuss it with their patients every day. Patients will often feel more comfortable talking about substance use disorders if it is in fact brought up by their physicians in a very gentle manner in which it is about offering help and assistance instead of a punitive approach. The challenges of having a conversation with patients during pregnancy is because it can make patients uncomfortable, and you can even, as a provider, be uncomfortable asking because you're uncertain about what to do with the information. The One More Conversation program from the health department is to make sure that you as providers can have as much information at your fingertips as quickly as possible to refer those patients and to provide patient information for any question that they might have in addition. And both of these together will facilitate the conversations you have about substance use in pregnancy.
My name is Michelle Shepard. I am a pediatrician, and I'm here today to talk about the One More Conversation campaign from the Vermont Department of Health. There is a toolkit available for providers that has multiple tip sheets. It has access to a whole list of online materials that you can print, that you can have available in your office. I think the provider tip sheet is helpful because it reminds you different ways that you can address questions, but also how you can start conversations throughout the entire pregnancy. The conversation fact sheets are helpful because it can be very much, instead of like giving someone an entire booklet on all the different substances, you can really target the one that they want to work on. It's very specific, has information about pregnancy, breastfeeding, what to do if you can't stop, and where to find more help and more information for treatment. So I think having both that conversation while you're there using the materials, but also as a handout, can be really beneficial. It sets the stage, right? So if you have set the stage in the common areas that this is something that we think is important, this is a conversation we're going to have, it kind of takes out the surprise factor. Also, I think it gives people maybe a little more comfort in knowing that we're asking everybody these questions. It's important that we continue to normalize how we talk about substance use throughout the lifespan, but particularly during pregnancy and breastfeeding, so that we can help parents have accurate information, have good, honest conversations with us, and make the best choices for themselves and their children.
One more conversation can make a difference.
One more conversation can make a difference.